Hello, my name is Sonia Harris. I'm a licensed speech language pathologist, and I wanted to talk to you a little bit about the difference between speech versus language. So, a lot of times you'll hear it lumped together and talked about like it's one thing, but it's actually two different things. So, let's start with language. So, language is how well you understand and how well you're able to express your thoughts into communication or speech. So that would be comprehension. Do you follow commands? Can you express yourself? Can you ask for what you want? Can you tell somebody how your day was? Can you label things that you see? Can you play? Because that's a form of expression as well. But all of that deals with language. Now, our language is divided into five different areas. And one is pragmatics, how well your social communication. One is semantics, that's word meaning, sentence meaning, phrase meaning, story meaning. Do you understand the meanings of things? Another area is what we call our syntax or grammar, and that's how you put the words together to form sentences. And then we have morphology, which is those bits of the words that have meaning. For example, an ing ending will mean that something is happening right now. An ed ending means that something already happened. So that's the morphology. It's like the form of the language. And then finally, we have phonology, which is kind of understanding the sound system. So all of that makes up language, and we have expressive, how well you get it out, and as well as receptive, how well you understand that. And all of that is language. Now, speech is, if I like to describe it, if you have cake, you have the icing on the cake. Speech is the icing on the cake. If you have all the language components together, that's the cake. The icing is how you form them correctly, because you may understand all those language components, but you don't say them clearly. So speech is kind of dealing with how well you get those out clearly. So they can be speech sound disorders, which are articulation. That might be, instead of r, an R sound, you might say w. So instead of saying red, you say wet. So that's an articulation. We also have phonology or phonological process disorders, and those would be the patterns of sounds. So you might, for all sounds that are produced, for all sounds that are, you're supposed to blow them out, you might stop them. So instead of saying fish, you might say bish. Instead of saying a sue, you might say two. For a sound where you might say, another, thinking of another blowout sound, for soap, you might say taupe. So you're stopping those. So that's a phonological process. It's more like a pattern of errors that you're doing. And then we go into, there's oral motor deficits, meaning that you don't move your tongue, your lips, your jaw, all of those things correctly. That might be the motor structure. That might be weakness. That can help, that can affect speech as well. And then you also have a couple other speech areas. We look at fluency, how smooth you get it out. That might be stuttering. We also look at what we call an apraxia. An apraxia is just incoordination of the motor movements. So the muscles are not weak per se, but you have difficulty sequencing them in the right order with the right timing to get your speech out clearly. So all of those are what we kind of look at for speech. I don't think I missed any, but I think, oh, and voice also, because if your voice is not correct, then people have difficulty understanding your speech. So those are kind of the two major categories. We have speech impairments and we have language impairments, and I kind of wanted to kind of just break it down. And this is helpful when you're going to see a professional. You can say, my child has a problem with speech, or my child has a problem with language. Most people are going to ask you follow-up questions anyway, but just so that you understand in terms of semantics, when we're talking about what is going on with the communication, how we classify it differently, and really the difference in approaches that we take, we kind of look at it, the difference between a speech problem and a language problem. But as always, if you ever have any concerns, find a professional near you to kind of help you piece through what is actually going on, and they can be an invaluable resource in determining what is the true underlying cause of the communication breakdown. Is it a speech problem? Is it a language problem? Is it both? It might be, but you do need a professional to help guide you through what's going on. So look for somebody in your area that's convenient for you and who is going to kind of work with you in this process. Okay. I hope that I made that crystal clear. That was kind of a long route to give you information. But as always, this is Sonia Harris again coming to you from Go Verbal LLC. And we just gave you a quick educational speech minute. All right. Thanks. Bye bye.